Hey guys, good afternoon. I hope you're doing well. Welcome to my YouTube channel. I'm really glad and excited to have you on board. My name is Dr. Victoria Nilima. We are still doing a series on contraception. Last was a video on the intrauterine device, the coil, and today I want to talk about implants. What are implants? How do they work? For how long can they be used? Do they have any effects on fertility? What happens if you get pregnant on them? And what are some of the contraindications and side effects of implants? Now, in our Kenyan markets, we have two types of implants. One, which we refer to as the Implanon, as can be seen there. That's how it looks outwardly in a box. And then the second one is what we refer to as a Jadelle, the one which can be seen there. Now, these implants are made up of rods. Implanon has one rod. The Jadelle has two rods. They are inserted on the inner aspect of your upper arm, just below the skin or subdermally. How do these implants work? They are progestin-only implants. They don't contain any form of estrogen hormones in them. So once these implants have been placed under the skin, there's going to be that gradual release of hormones, the specific hormone levonorgestrel release gradually into your system. When this hormone is released, it's going to interfere with the release of key hormones from the brain, what we refer to as the luteinizing hormone and the follicle stimulating hormone. These two hormones are necessary for ovulation. So by them being suppressed, ovulation is also going to be suppressed. And then the second thing in how these implants are going to work is that they're going to reduce the speed at which the ovum gets transported from the ovaries after it's released up to the fallopian tube, where fertilization normally takes place. The third way in which they work is that the hormone is going to interfere with the development of your endometrium that's just inside your womb. So it's not going to develop adequately, and as a result, implantation is going to be affected. At the endometrium, inside your womb, is where implantation takes place. So if this specific wall or endometrium is not strong enough to support implantation, then growth of the fertilized egg is not going to happen. Now, the fourth way in which they act is to interfere with production of your cervical mucus in a way that either it becomes scant or it becomes very thick. This is going to interfere with the migration of sperms once released from the male body. How are they inserted? And this is a video that I'm going to show you how they get inserted. So let's start with the first one. That is the Implanon. Contains 68 milligrams and etonogestrel, a progestin hormone. So this was just for the purpose of us knowing how it's inserted, and the patient here gave consent to this video being taken. After insertion of the implant, what are some of the side effects? And number one, irregular bleeding for the first at least 6 months. And then the second thing is you could experience some headache, breast discharge, some dizziness. After about 6 months, the menses tend to start becoming normal. There are people who are not supposed to use implants. So the first group of people are those with abnormal uterine bleeding. Second group of people are those with a suspected pregnancy, those with a liver disease that is active, those with an issue with the blood vessels, coronary artery disease, atherosclerosis. They are actually not supposed to use these implants, and those with suspected malignancies of the breast in many occasions. So once you put these implants, they won't start working immediately within the first 7 days. So it's only safer for you that within the first 7 days, you use another form of contraception, if it's the condom or if it's the pill, or if you can abstain for the first 7 days following insertion of the implant, that will be okay. Implanon takes 3 years. Jadelle, that contains 2 rods, takes 5 years. Upon removal, fertility returns within 3 months in 50% of the population, and within a year in the remaining population. That's all I have for you today concerning the implant. I hope you have learned 1 or 2, 3 things. Next, we're going to be talking about the combined oral contraceptive pills, the ones which you take for 28 days, 21 days. Have a lovely evening, and may God bless you.